on the road.
We're on the road.
On the road. But any kind of travel, we got to pay attention to people getting sick.
100%.
This is the time of year that people are going to be need to be a little extra cautious. Of course, everyone's excited to see their families, excited to travel if you're doing that, whether on the road or in the air. However, we want to pay extra attention to all sorts of sicknesses that you can pick up as you're traveling. And that's why we are starting today with a health expert. This is Dr. Ruth Carrico. Dr. Carrico, thank you so much for joining us today.
Thanks so much.
Well, let's start with, as I kind of set us up with all this travel that we got coming up in the next couple of weeks, what are the illnesses people need to watch out for this time around?
You know, you were perfectly right that it doesn't matter whether you're in a plane or in a car or just meeting together in a room. There are a number of respiratory viruses that challenge us every year. This year's no different. We have three, I think, that really come to mind, and that is flu or influenza, RSV or respiratory syncytial virus, and of course COVID-19. All of those are diseases of breathing. So just as you mentioned, we all get together, regardless of where that is, all of us are breathing, and without some plan for protection, then we run the risk of either transmitting illnesses or breathing them in, acquiring them from others.
I'm glad you brought up the illnesses that we're paying attention to, especially I want to point out, just while I have you, COVID-19 still a problem. Although the pandemic lockdown is over, COVID-19 is still something we deal with, right?
It certainly is. It's one of those respiratory viruses, and I'm really happy to have the chance today with Sanofi Pasteur has enabled me to partner with them and bring health information to you, to your audience, so we can get a picture of what it means to protect ourselves as a unique individual.
Yeah, and so what are some of the things that people can do to make sure they don't contract or protect themselves as much as possible from contracting one of those illnesses?
You're right. You know, nothing's a guarantee, but I think a good place to start is let's remember what Mom told us. And Mom said, make sure that you don't go anywhere when you feel badly. Stay home. Don't share that love with others. Make sure your hands are clean. If you have to cough or sneeze, do so either in a tissue or in your elbow. Those are kind of our basic things. Well, what about some more advanced interventions that we can do? And I think a good starting place is talk with your healthcare provider. I love it when I have a chance to talk with patients about what is going on with them as unique individuals, and then develop a plan of action that looks at their underlying health conditions, their activities, what's going on in their lives, and is personal to them.
Especially because anyone with maybe a pre-existing condition may be at more risk. But I'm curious if there's anything or anyone in particular that might need to be paying more attention. I know you mentioned RSV. Typically when we talk about that, we do talk about kids.
Yes, you're right. And so let's start at that end of the spectrum. When we have newborns, they're born without a really robust immune system. So they rely on us to help take care of them. So we can do things such as provide them with an antibody against RSV. Well, what about older adults, the other end, maybe those visiting grandmas and grandpas? Well, let's protect them. Influenza, we have vaccines focused on the older adult, that higher dose flu vaccine. COVID-19, the mRNA and non-mRNA vaccines, and then, of course, RSV. And then what about everybody else with underlying medical conditions? Let's remember those: asthma, heart disease, diabetes, and others. We have vaccines that are meant for our community, our people at large. So get with your healthcare provider. Recognize everybody's different, so your healthcare provider knows you best. Talk with them, get their advice, and remember, it's never too late. So every time you visit a healthcare provider, think about that as a vaccinating opportunity, a chance to develop your plan of action.
I like that you phrased it as, kind of what your mom said. Sometimes the simplest advice is the best. Wash your hands, make sure you're not coughing on other people. Is any, though, of these illnesses that you mentioned, I know they're all spread in similar ways, but are any of them, kind of piquing your interest or concern this season as something that's becoming a little bit more common?
Well, I think, remember, COVID-19 has not gone away, so don't dismiss it. It is still creating problems. Flu is with us every year, and remember last year it was a particularly bad flu season. So it just reminded us, we need to respect these respiratory viruses. And RSV may be kind of a new term, a new vaccine. So again, talk with your healthcare provider. Find out what is the right thing for you and your underlying health condition, and then develop your plan of action, and then figure out the best way for you to move forward.
Dr. Carrico, anything that we haven't talked about that you think people need to know or that would be really important for people to hear?
Well, I think it's remembering that all of us want the same thing. We want to have a great holiday season. We want to be able to spend time with friends and family, loved ones. Let's have a plan so that we can do that safely and give us the opportunity to celebrate what we have ahead of us in these next coming months.
Celebrate really is the word. Hopefully people can take that advice and go travel and see their families safely. Dr. Carrico, thank you so much for that information.
Thank you.